Competence in the clinical skill of intradermal injections is demonstrated by uploading 10 videos for review by the course instructor. The technical requirements for these videos include real-time continuous audio and video throughout the clip with no evidence of editing. Additionally, each video uploaded must be accompanied by a signed consent form that includes consent for the student, supervising clinician, and patient or model to appear on video, and for the patient or live model to receive an intradermal injection. A sample consent form is provided in the intradermal injection module. The signed consent form will include a provider's order for an intradermal injection. The medical assistant must read the order aloud, select the correct medication from the tray, and select the correct needle and syringe from the options available. After cleaning the med bottle with an alcohol wipe, he or she withdraws from the bottle the correct amount of medication. The medical assistant checks for air bubbles and removes appropriately and presents the medication for review and approval by the provider. The patient is not usually present for this step in the actual clinical setting, but may be present when using a live or simulation model. The medical assistant should verbalize the steps involved throughout. For example, I have an order to give 5 tuberculin units intradermal times 1 from Dr. Smith. I have selected a 50 ml multi-dose vial of Tubersol labeled 5 TU per 0.1 ml. I've selected a 31 gauge needle and a 1 cc Luer lock syringe. I've opened an alcohol wipe to clean the med bottle. I've assembled the needle and the syringe. After cleaning the med bottle stopper, I am withdrawing 0.1 cc of air into the needle to inject into the med bottle. I am now withdrawing 1 cc of Tubersol, which is equal to 5 TUs. After removing any air from the syringe, I will recap the needle and present to my provider for review. Dr. Smith, please confirm. I have an order for Tubersol 5 TU intradermal times 1. I've drawn up 0.1 ml of Tubersol 50 doses per 5 ml solution from the multi-dose vial for intradermal administration into patient Jane Doe. The provider will confirm that you have prepared the correct amount of the correct medication and instruct the medical assistant to proceed with the injection. The student will introduce him or herself and his or her role as a medical assistant. The student should also identify and introduce the clinical supervisor present for this invasive procedure. The student will explain the procedure to the patient and the steps involved. As part of the initial introduction, the student should confirm the patient or model's understanding of the procedure and elicit their verbal consent to proceed on video. For example, "Hello, my name is Joseph. I'm one of the medical assistants here in the clinic today. Can you tell me your name and date of birth?" "Thank you. Here with me today is my clinical supervisor. His name is Dr. Smith. As you probably know, your provider has ordered a medication called Tubersol to be given by intradermal injection into the superficial skin layer of your inner forearm. Do you have any allergies to medications? Have you ever had BCG or PPD injections before? Were there any difficulties with this medication in the past? No? Good. Then if you're ready to proceed, I'll ask you to roll up your sleeve while I wash my hands and get some gloves. This injection will not be unlike other injections you've probably had in the past. I'll clean the area with some alcohol, insert the needle, inject the medicine, withdraw the needle, and lightly wipe with a cotton gauze. This injection does not get covered with a bandage. I will draw a circle around the injection site with an ink pen so that it can be re-examined in 48 to 72 hours. Please don't wash off the ink until you've returned to the clinic for re-examination. Any questions? After patient's questions are answered and with the patient's consent, the medical assistant puts on clean, non-sterile gloves. The medical assistant verbalizes the area for intended injection, such as inner forearm. The intended injection site is cleaned with an alcohol wipe and an expanding circular motion. The needle cap is removed and the needle is inserted at a 15-degree angle into the dermal layer of the skin. Without attempting to withdraw the syringe plunger, the medication is injected into the dermis, raising a dime-sized wheel, and then the needle is removed. The area may be wiped with a cotton ball or 2x2 cotton gauze. A bandage is not applied over the intradermal injection. Since this injection site will be reevaluated in 48 to 72 hours, a circle is drawn around the injection site for future reference. So Mrs. Morrow, we have an order to place a PPD from your doctor. I'm going to be injecting a small amount of tuberculin solution right under the skin. I'm going to draw a circle around it so that we can take a measurement of your reaction in 48 to 72 hours. Okay? So I'm going to start first by pulling out my gloves. Taking my alcohol wipe to clean the area. And take my tuberculin syringe. I'm going to examine, make sure there's no air in the needle. I'm going to go bevel up right under the skin at a 15-degree angle. Once I'm under the skin, I'm going to track in right under the surface of the skin. I'm going to raise a small bump of tuberculin fluid, draw my needle, and where that small bump is, I'm going to draw a circle around it so we can measure the amount of induration in 48 to 72 hours. The medical assistant safely discards the needle and syringe in a sharps container without recapping the needle. He or she then removes and disposes of gloves and appropriately washes and sanitizes his or her hands. The medical assistant correctly charts the medication, dose, route, site, and patient response. For example, Miss Jane Doe received Tubersol 5 TUs injected into left inner forearm. It was uneventful and well tolerated. Joseph Smith, CMA, 2/15/2018, 3:30 p.m.